Hi everybody, this is Kaylee, or I'm also known as Kales. That's my nickname and the name that's on this channel, which is Kaylz. And it's just kind of my preferred name. Anyways, I'm here to kind of introduce myself, say hello, and just kind of get the ball rolling on my end. I know some people are confused as to what this is and why. Some people seem really interested in why I would bother with this particular subject matter and what could I do and whatnot. So let me start out by saying that I am not a medical professional. I'm not a therapist or a psychiatrist. I'm just someone who's been through a lot of pain, trauma, shit. I mean, that's the best way to say it. I mean, I've just been through it since the age of 9, really. I feel like I've been fighting evils, if you want to call them that. So I noticed last year I went into the hospital and I needed help mentally again. And my boyfriend had no clue what the hell was happening. He knew I had depression. He knew I had anxiety. I mean, he kind of knew, but he wasn't like fully aware. And I had been drinking, and then I guess I was saying some suicidal things. It was right to the beginning of November. I'm not going to give out specifics I'm going to try to not give out specifics on anyone. And if someone is a part of a story or situation, I will not be using his or her name unless given permission. But this is really about my story, not theirs. It's just more how I handled my side of maybe their issue. So I'm going to adjust the camera. Is that better? I don't know. So, all right. So, I went into the hospital. My boyfriend was really confused, really hurt, really just did not know what to do with someone who at that moment was going through emotions that she couldn't really control. And it was out of my hands. It felt like, I was out of control myself, and he subsequently felt the same. And my mom called his mom, and she kind of stepped in. Excuse me, I have cats, so if you hear meows, it's them. And believe it or not, I do have a boyfriend and cats. Believe it or not. Anyway, so, sorry for the meowing. Obi's loud. But my mom called 911. My mom knew kind of what was going to happen, because it had happened a year before. Another situation arose in which I handled so badly. The ends of relationships are hard, whether they're the end of friendships or relationships or even jobs, if you're close to people and stuff. So I had been in, the time I was with my mom, I had actually gotten really drunk and taken stuff, so I was really, really gunning for it. So, I have that personal experience of that. And when I saw my poor boyfriend in tears, the next day when he came to visit me at the hospital, he was so scared. And he had no idea how to handle it. Thank God my mom had been through it with me, I think 2 other times, at least once, and maybe one time on my own. So she knew some kind of way to do this and some kind of way to handle and what to expect, really. And so at least he had a little bit of knowledge, but there was no one. It's not like the hospital reaches out and it's like, hi, yes, OB, hi. Your loved one's in the hospital. Do you know what's happening? Do you want to know? Do you want to talk? That doesn't happen. Your loved one gets 5150. That's a mandatory 3-day hold. I shouldn't say mandatory. If the doctor chooses to let you off of the 72-hour hold before that time is up, that's fine, but it has to be approved by a psychiatrist. After 3 days, they can't legally hold you unless they feel the need is so severe to put you on a 5152, which is 7 to 14 days hold that they can have on you. And there's no one. There is no one to help. There is no one to coordinate what's going on. So in that situation, it really bothered me when I kind of sobered up and realized, like, oh, crap, look where I am. This is not good. I did not handle this well, And it just felt like there's a gap to fill. I felt like there's a need. I felt like as a patient, especially at this one facility, I got 0 actual care. They kept me on the same medication I was already on. Basically, they had me for 2 days. They let me go a day early because I was fine once I sobered up. More on that later, but, no help. Just fear. He was just so scared. And that was really painful and really shitty. Sorry. That's just how it was. And I had previously, 10 years ago, 12 years ago maybe now, I had someone who was close to me that was taken on 5150, and we were told that they were on meth. They were arrested in the living room of their own home, told, you're going to jail. That person went to jail, and we begged them to please send him to a mental hospital. He had broke his hand in prison or jail, punching the plexiglass, actually screaming for me because he didn't know what was happening. It was his first psychotic break. He had no idea. He had no idea what was going on, and we didn't either. And we just kind of made it up as we went. And his parents, in the end, ended up just really praising me for my ability to kind of like stick through and stand by him for that. And, I called insurance places to get him insurance because he broke his hand in half like this way. So it's called a boxer's break, I guess. So there's 3 pins in his hand now. So he needed major surgery, which they just did, because they needed to. He was under their care. And he didn't have insurance. I mean, the bill for that, I think, was like $200,000 or something for that entire... Sorry, my boyfriend just texted me. Go away. Okay. So, that's like $300,000. I don't know about you, but I don't have that laying around. Luckily, we got insurance. We were paying off those bills for years. So, and I know, by the way, that I keep forgetting to talk into the camera and I'm looking at myself. I'll work on that. So anyway, 10 years ago, 12 years ago, I went through this on the other side. I know kind of how this goes on the outside, as my mother now knows, going through it at least, I think, 3 times with me. Physically with me once, but 2 other times she was involved. Because she's a mother and that's what they do. Thank God. So I've been on both sides of that. I kind of know the situation. I know how scary a 5150 is. I know how scary it is as a patient. They cannot legally tell anyone anything about your treatment unless you sign an agreement saying, or a sheet of paper saying, like, this person can know what's going on. This person can have limited information on what's going on. This person can, or, if you don't put them on the list that the hospital can talk to them, they won't. And same with a lot of rehabs. I think all rehabs, I'm sorry, I can't confirm or deny that patient is here. Can't do it. So, one time I was missing and my mom called everywhere, and that's what she got. She just got, sorry, can't confirm or deny. And I was in none of those places. More on that one later. Surprise, it's about being arrested. So there's that. There's mental health. I'm also an ex-IV heroin user, opiate abuser. Not really a weed fan. I wasn't like a garbage pail junkie. Like, I'd just do anything. It was pretty much opiates. Later, recently, I had discovered that I somehow had become an alcoholic, even though I hate alcohol. So that sucked to realize that I just cannot have it. I don't even like the taste, but I don't like being in my own skin sometimes. I'm really uncomfortable with being me. Okay. They only allow like 15 or 16 minutes, by the way, for your first video. And I'm at 12 minutes. And half of you have probably stopped watching this. So I'm going to try to wrap it up really, really quickly. So for me, that's about 2 minutes. So anyways, I've been an addict. I've also had a loved one that he had used a dirty needle and ended up in a coma. And he died, actually. He died 4 times in 1 year. 4 times. And that was too much for me. He obviously, he's still living now, as far as I know, but I've blocked that person. I just can't with that particular person. So anyways, I was there for that. I've also been the victim of physical, emotional, and sexual abuse. So I know all of that. I'm just here really to talk to you about it and to open up communication lines, let you know that there are people out here who care. I care. I don't know. Maybe you don't care. Maybe you don't. Helping people isn't your thing. That's fine. But I'm kind of trying to be like a liaison, if you will, between maybe a mother who doesn't know what her daughter's going through in rehab and the girl who's in rehab is scared shitless because she's in rehab. That was a shock. And I asked to go there. It's for the man whose wife is having a psychotic break in her 30s or 40s, because that's when bipolar shows up for a lot of women. I'm here. I'm listening. I want to help people. I want to hear what's going on. I want to open up lines of communication. I want to take this stigma away from mental health and from just addicts and what we are and what we aren't. And I really I want to open doors and I want to change things, and I don't know how to do it. I don't. But this is a hell of a way to start. So hopefully you'll like this. Hopefully you'll subscribe. Hopefully you'll like this and you'll leave a comment and we can start talking and getting somewhere. I am here. I am listening.